Back to COVID-19, which is surging here and throughout the country. Now, in addition to the sickness and symptoms, there are also the mental health effects. A new study showing that COVID-19 survivors may be at an even greater risk of mental health problems. So our 9 Health expert, Dr. Payal Kohli, joins us to talk about those implications. Dr. Kohli, this study found 1 in 5 COVID-19 patients could develop a mental illness within 90 days of their diagnosis, and those numbers are alarming.
Tom, they're absolutely alarming. And as you pointed out, it's not just the physical effects of the virus, but now we're learning about the mental effects. And we've talked a lot about the different curves of the virus. And I'm afraid that this is really heralding in the mental health curve, which is going to be very difficult to flatten. And it's going to be something that potentially lasts for several years, if not for decades. So this was a study looking at 69 million electronic medical records. And out of that, they looked at 62,000 COVID cases. And as you pointed out, Tom, they found that 1 in 5 people who had had COVID and recovered within 90 days, so very soon after infection, had a new mental health diagnosis, whether that was anxiety, depression, or insomnia. And this was, just to give you some context, about 2 to 3 times the risk in the general population. But Tom, the other interesting finding in the study was that the risk works bidirectionally. So it wasn't just that COVID increased your mental health risk, but mental health problems increased your risk of COVID. And in fact, those that had a pre-existing mental health diagnosis had a 65-fold higher risk of COVID.
So do we know how that works? I mean, even the math of COVID leading to mental issues somewhat makes sense. We've talked about fog and depression and all those other things, but that other avenue you talked about, mental illness, increasing someone's chances of getting COVID, seems like that might be harder to figure out.
Yeah, exactly right. So part of it is what you said, which is the physical effects of the virus can increase your risk for depression, for anxiety, for insomnia, long-term problems because of that mental fog. Part of it, we believe, is that the virus may actually have a direct toxicity to the central nervous system. And we know this virus can affect your sense of smell, sense of taste. Now we're learning that it may actually affect the emotional parts of the brain as well and cause direct toxicity. And then finally, I would say, Tom, it's the psychological impact as well, of having this contagious, very severe virus without a treatment, and of course all of the, the fear that it generates in the people around you. But the other direction is a little bit more complicated to figure out, as you point out, but it's possible that those types of mental health problems can increase your risk of substance abuse, increase your risk of behaviors that may then eventually lead to an increased risk of COVID.
Well, at the top of the hour, we heard a story about Pastor T and his recovery from COVID and how long and tough it was. What do we do to help people? What can we all do to help people who have recovered from COVID-19 to reduce their risk of falling into that sort of mental illness?
Yeah, this is a really important question because as we cross 10 million cases this week, 2 million of them are going to have these mental health problems. And I think we as a community really do have to play a part in helping them recover from that. And the biggest piece of that I would emphasize is this coronaphobia, which is this fear that people have of other people that have recovered from COVID, the stigma around having had COVID and the recovery from it. So I think first part of that is to really work on dispelling that coronaphobia, re-embracing those members back into our society, not being afraid of them because they're no longer infectious. We don't need to avoid them. The second part of that, Tom, is I would say make sure if you have a friend or family member that's had COVID, you keep your radar up. You look out for those concerning signs and symptoms and you connect them with the resources that might be able to help them.
It reminds me, if you go far enough back, of the fear that many had of HIV and AIDS, and ultimately some well-known people picking up children with HIV and AIDS and sending the message that it's okay. And these people should be treated as people going forward, and hopefully the same. When you talk about coronaphobia, that maybe that'll be something we'll all learn to do better. Dr. Payal Kohli, thanks. Coming up on 9 News at 5, we're going to look into the mental health impacts on COVID-19 healthcare providers like yourself, Dr. Kohli, some of whom have also been patients. Again, that's coming up at 5 o'clock.